Okay, now we're live. Here we start with the first station. This is the Exo Scope area, and we have Orbi and Chad's here to talk about it.
So this is the Orbi system. It is an Exo Scope, or it's 4K 3D technology. And what's nice about this system here is you can articulate the head. Essentially what we're trying to do is we're eliminating the need for the ocular lenses, so everything is heads-up surgery, so it's immersive for the entire room. And it's also very ergonomic for the surgeon. There's a lot of things we can dive deep in as you circle through, so we'll get hands-on, and I look forward to working with everyone.
Great, thank you so much. Moving on, this is the other Exo Scope, and we have the Storz VTOM. Stephen.
Hi, thanks. Again, the Storz VTOM 3D Exo Scope. Again, you're able to stand back and operate off of the screen without having to look down. Hopefully it'll take place of a microscope for a number of your cases. So again, we give you the ability to see depth as well as everyone else in the room being able to look around and see, watch you on the screen. So we look at this as a bridge technology from open surgery, get used to working off of a screen and then making our way down to endoscopically assisted tube surgery as well as fully endoscopic. So one good step in doing this. So it's a nice platform for the rest of our video components with 3D 4mm scopes as well as 4K and ICG. So thanks for having me again this year.
All right, thanks, Stephen. Moving on to the Globus station. Here's Mir. Good to see you, Mir.
Good to see you. So here we have Excelsius GPS. Obviously, we're known for our rigid robotic arm that can handle 180 pounds. Active end effector, so we always know where the center of the tube is. And if you look at the setup here, we have a reference base and another marker. So one of the things we can do is we know if the reference and the registration is inaccurate just by that going up or down. And you can see that that's fallen back into place, so I'm ready to register. I can move on, move over to my trajectory. Yellow means that I've locked into trajectory, and green means that I'm at the ideal height. And go ahead, put an instrument down. And one of the things that we have unique to us is robotics has a straight trajectory. We look at deflection forces. And if you do deflect off your course, you can see that you potentially have higher forces based off of the moment seen by the arm. We do have a couple different ways to use the system. We have intraoperative CT, such as a Zimmer RFD or O-arm. We have fluoroscopy, which is a 2D imaging, or in this case, preoperative CT. Thank you very much.
Thanks, Mir. All right, moving on. We're going to go to the Augmetics booth, and here is Nissan.
Hi. This is the Xvision. Xvision is an augmented reality head-mounted display surgical navigation system. It has transparent lenses, and it has all the components of traditional navigation system with all the tracking, very accurate tracking on the headset itself. As you can see, there are no external cameras hanging around, so all the tracking is done from the headset. Surgeon put it on the head, and he can look straight on the patient and get X-ray vision. Just like having an X-ray vision, he can see the anatomy of the patient through the skin and tissue and align the instruments directly at the correct position. We also have a few features. Some of the headsets come with a headlight. This is a completely wireless system. So some features here include various methods of visualization, transparent mode, and it can be used for open and also minimally invasive surgeries.
Thank you, Nissan. Okay, keep following me. We're going to move on to the 7D station. Here is Bo.
Hi, everyone. My name is Bo Standish. I'm one of the founders and CEO of 7D Surgical. You saw a bit of the preview with Dr. Yang's introduction to the technology. So here, all of the technology is integrated into the form factor of a surgical light, which means the surgeon can control everything during the procedure sterilely through touching the light handle and through a foot pedal that's underneath the table with very limited interaction. As you saw in the demo before here, I've just registered. I'm going to mess up the registration. So here I've moved my reference array. You can now see that this is, actually mess it up some more. I'm now outside of the bone. Remember the power of machine vision, that same concept that allows autonomous vehicles to make decisions as it's driving down the road. Here, I'm gonna do my flash fix, take a single flash of our structured light information. It's now going through and comparing what has changed in 3D from originally to now. And in just about 5 seconds, you'll see that I am back inside of that canal, and here we go, we're back online. So the only technology that can auto-calibrate at any time during the procedure because we only use the power of visible light, no radiation. Thanks very much. Come on by the booth and we'll give you real quick demonstrations the rest of the afternoon.
Thanks, Bo. Okay, moving along. Here we have the Brain Lab station with
Hi. Hi, so here we're showcasing our interoperative 3D imaging, spinal navigation, and robotics. This is our Aero mobile interoperative 32-slice diagnostic quality CT. It's capable of scanning 100 centimeters to image the entire spine in one spin, as well as imaging the entire pelvis with a width of 51 centimeters. We have our curved dual display navigation system here to the right with our navigation software. And this is our first generation robotic arm for spinal drilling called CIRC. It's a lightweight portable system, really zero footprint, attaches to any standard OR bed rail, and holds a drill guide for stable working channel to power drill and cannulate your pedicle. It has 7 LED capacitive electrical sensors. When squeezed to once, the joints become unlocked. You can then align to the trajectory based on live navigation. Squeeze again, joints are locked, and you now have a stable working channel to power drill. And thank you.
Thanks, Mary. All right, we're moving right here to the Mazor station with Sarah.
Hi, so today we have the Mazor X Stealth Edition. It's very similar to our current system, Mazor X system, but we have integrated the Stealth software into our Mazor workstation. So all of the Mazor principles still apply. We have 2 workflows. You can use a preoperative CT and merge with 2 fluoroscopic x-rays, or you can do an O-arm spin, plan in the operating room, and skin the cat that way. So the way that we layer our navigation on top of our existing robotic registration is we send the arm to a predefined trajectory. We place our tracker on the arm. The camera sees both our robotic reference frame and our tracker. We take an image, the software saves that, and now we are able to layer our navigation on top of our existing robotic registration. So now we can navigate our drill, our dilator, our taps, our screw through the robotic arm.
Great. Thanks, Sarah. All right, second to last station. Here we have Amanda with Zimmer.
Thank you so much. So here we have the Walter Lorenz surgical assist arm. It's a biomechanical, bionic, electromechanical articulating arm. So it's surgeon driven. So as you can see in the surgical field, low profile will attach to any bed rail clamp. And with the push of 1, 2 buttons, it will release in the field, release, and it will hold any instrument in that trajectory that you've set. So what we have here, we have a number of direct connect instruments that you can attach directly into the end effector here, or we have these universal adapters where you can attach pretty much any instrument that you would need in a surgical procedure directly onto the Walter arm. So come by and we'll show you how it works.
Thank you. Okay. Moving on to the last station, Dr. Kim doing the Medtronic station.
I wanted to introduce James Booth. James, this is our stealth station, Medtronic, navigation, O-arm. As you know, there's now a upgraded S8 stealth station and the O-arm too. So I'm going to have James go over the details.
Thanks, everyone. Hi, this is the 8th generation stealth, so the brand new stealth. A faster computer, finally. We have 4K high-definition monitors, 2 monitors, both touchscreen. We have gestures similar to your phone if you want to pinch to zoom in and out. New camera vendor, so wider tracking, better tracking. 2 monitors now, same size 28-inch. Before we just had 1 big monitor, 1 small monitor. We can navigate the Midas now, so this is a navigating drill that Dr. Kim will use. Over 200 instruments that we can navigate, so a bunch of spine instruments. And Dr. Kim's going to lead us through a couple things.
And then certainly, we don't have it today, but the ORM2 is now out, 50% less radiation administered to the patient, low definition modes that continuously drop the radiation delivery to acquire the same amount of imaging specificity or resolution. So thank you.
All right, thank you very much. So this is the time now. We'll have the attendees come into the lab, take a change into scrubs, and have a chance to evaluate all the different technologies. Thank everybody for coming and watching live. Next year, 4th annual.
And I want to thank Doniel, Drazin, and Terry Kim. These are the guys that make all this happen, and all of our sponsors, all of the corporate people here. And for everybody out there on the internet that's watching this, is that just so you know that this program that's put on here is probably it, without a doubt, because we know the whole world of this technology. It is the best collection of all the technology that you see around us here, of anywhere, of any meeting in the world. And it's something that if you want to learn about image guidance, and robotics, and emerging technologies, this is a place to come and see it. So, guys, congratulations, and thank everybody that's worked so hard.
Thank the
and
Seattle
also the
Science
attendees and the Seattle Science Foundation.
Great.
Thank you.
Thanks, everybody.
Bye-bye.